Okay guys, today we're going to talk about choosing the best Medicare supplement plan. And for those of you that signed up for my 6-day new to Medicare video mini-series, this is day 5, choosing the best Medicare supplement plan. So right here is a chart. It's a Medicare, it looks complicated. Plan C, D, F, all the way through N. Guys, we're going to look at the plan N. We're going to look at the plan G. We're going to look at the plan F and the high deductible Plan G, which is great for folks that live in New York or Massachusetts or Connecticut, where there's no underwriting. You can go pick any plan you want. We're going to talk about that in a little bit, but the high deductible G is the way to go, because if you get sick, you can always go to the regular G with no underwriting questions asked. So just ignore the A, the B, the C, the D. Ignore the K and the L and the M. If you look, the benefits are not as robust and the premiums are more. Okay? So, also, right below, click the subscribe button. Help me out. Help me to help others out. Help me to help you. Remember that? What was that? Jerry Maguire. But seriously, I am an educator. I educate, empower, and enroll folks, and they're confident once they enroll because they have all the facts. So hit subscribe below, and let's get into it. Okay, guys, before we break down the top Medicare supplemental plans of 2024, there are a few things that always ring true of any Medicare supplement, no matter which plan letter you choose or which insurance company you choose. First thing is you have to realize all Medicare supplemental plans are non-network plans. So, for instance, let's say you choose United Healthcare AARP Plan G. You don't have to go to a United Healthcare doctors because these Medicare supplemental plans are secondary to traditional Medicare benefits. That red, white, and blue card you get when you turn 65 or enroll in Part B for the first time. So when you go to a doctor or a hospital and you're whipping out your red, white, and blue original Medicare card, you can always go to any provider who accepts original Medicare. Even if those doctors say, hey, we don't take United Healthcare, we don't like working with them, doesn't matter. If they take Medicare, they have to take the United Healthcare Medicare supplement. So it supplements your original Medicare benefits. Your original Medicare, the red, white, and blue card, is primary. They must and they will take your United Healthcare plan, even if the front desk lady says we don't work with United Healthcare. Just ignore it, because what's going to happen is they're going to bill Medicare, and that 20% that's left over, the Medicare is going to send that to United Healthcare, and they're going to pay the rest of it. So you don't need to worry about. These are non-network plans. You'll never need referrals either. If you have to see a specialist with a Medicare supplement, there's no referrals. Again, it's a non-network plan because original Medicare is your primary insurance. So it's you and your doctor working on your treatment plan. As long as Medicare approves the service, it's going to be approved by your Medicare supplement. All right. Another thing about Medicare supplemental plans is that these plans' benefits will never change. So that if you enroll, let's say you enroll in a Medicare supplement plan G, those benefits are never going to change because they are guaranteed renewable for life, which means that you will always keep your same benefits for plan G. As long as you continue to pay your premium, your plans are never going to change. All right, guys, so the 4 plans that we're going to look at are the plan F, the plan G, the plan N, and the high deductible plan G. Now, so the plan F is the first Medicare supplement of the 4 best Medicare supplements we're going to talk about. Keep in mind, if you're new to Medicare and you're turning 65 or enrolling in Part B for the first time, you can't get the plan F. Plan F was retired back on January 1st of 2020. Plan F is the Rolls Royce of all Medicare supplements. It pays absolutely everything. If you look at this chart right here, it pays your Part A deductible, pays your 20%, pays your Part B deductible, that $240 annual deductible that Medicare makes you pay. It pays that. It pays everything, guys. And here's the problem. It was overutilized. If somebody had a headache or they were just bored and wanted to socialize, they'd go to the doctor. They go to the doctor for everything. Very high claims. Because they had such high claims, the premiums really skyrocketed on the Plan F. And although I don't know why you would do it, if you were over 65 on January 1st, 2020, you can still enroll in the Plan F. The Plan F has an older, sicker pool of people. But if you're wealthy, if you're really affluent, and you live, I don't know, out in Wexford half the year, and you live someplace, maybe Vermont, and the other half of the year, and you just love the fact that you can leave your checkbook at home, by all means, go for it. Get the Plan F if you were over 65 on January 1st of 2020. But I wasn't really selling it back then too much. Back in 2010, when I started as a salaried employee with Humana, it's just I could do the math. Okay, guys, so just remember, the only difference between the Plan G and the Plan F is the Plan F pays the Part B deductible. For 2024, the Part B deductible is $240. So if that's the only difference between the F and the G is that little annual $240 deductible, let's take a look at my little quote tool. So here's a 70-year-old male, because remember, if you're 65, you can't get the Plan F. So the Plan F pays everything. The Plan G pays everything except the $240 deductible. So lowest Plan F in Beaufort County is Medico. It's $143. And let's just run it off to $144. It's $143.77 a month. So let's look at a Plan G in Beaufort County for a 70-year-old, the same 70-year-old guy. He's shopping between an F and a G. He likes the fact that with the F, it pays everything, never has a bill. He likes the idea of leaving the checkbook at home. But he looks at the Plan G and says, okay, it's $101 for the Plan G. Wow, almost $144 for the Plan F. So what do? We subtract $143.77 from $101.04. So we're saving roughly $43 a month in premium if we go with the Plan G. So it's going to save us $504 annually. So, but remember, we do have to subtract the $240 Part B deductible because you got to pay that with the Plan G. But guys, you're still saving $260 a month in premium. So what if you got to pay a $240 deductible if you're saving $504 in premium? You guys can do math too. All right. So moving on to Plan G. Plan G does everything the Plan F does. In fact, once you pay the $240 deductible, the Plan G turns into a Plan F. That's another way to look at it. Okay, guys, the next Medicare supplement, the third of four that we're going to discuss because these are by far the best Medicare supplement plans of the bunch, is the Medicare Plan N. Now, if you look here, almost virtually the same as the Plan G. You still got to pay that $240 Part B Medicare deductible. It's an annual deductible. And there's something else called excess charges. And below this video, you can see the independent study that was done by Cigna underwriters that breaks down beautifully why the Plan N has more value than the Plan G, in my opinion. The Plan N, once you hit that $240 deductible, it's got some copays. When you go to a doctor's visit, it's between 0 up to 20. Up to 20. It'll never go past $20. We found that we looked at all the copays over the years of Plan N, folks, and it's right around $13 is what it comes down to for a doctor's office copay. Now, they could charge 20. They might charge 0. It depends on what's going on with the doctor's visit. And there's a $50 emergency room copay. That's the only difference between these plans. Now, excess charges are very rare. Why? Because 97% of all doctors accept Medicare assignment. So if you go to a doctor, I know there is a doctor in Hilton Head, doesn't accept Medicare assignment. But then again, I've never seen him charge people that don't accept Medicare assignment, providers, doctors that don't accept Medicare assignment can charge 15% above the Medicare assigned rate. Real easy way around that, you type in the doctor's name on Medicare.gov. If he's one of the 97% of doctors that accept Medicare assignment, he pops up. And again, below this video and after this video, you can click on the next video, and it is why agents only sell the plan G and not the plan N. And it's got a lot to do with how agents get paid. All right. So plan N, if you are concerned about rate increases, you might want to look at the plan N over the plan G. That Cigna study will show you over the next 8 to 10 years, the plan G rates are projected to be double plan N for the simple reason they have to take sick folks, chronically ill sick folks. For instance, somebody that moves from Ohio that has a Medicare Advantage plan, and he moves to Hilton Head. Let's say he's got COPD and stage 3 cancer. That Advantage plan, which it's very rare that an Advantage plan in Ohio is going to be offered in Beaufort County for the simple reason that these are localized HMO, PPO plans. So you're going to have to, the beauty of that is if you're sick and you move from Ohio to Hilton Head or Bluffton, and you have an Advantage plan that's not offered in this area that was offered in Ohio, you can get a plan G, not a plan N, a plan G with no health questions or underwriting whatsoever. If you lose your group or retiree coverage, you can get a plan G, not a plan N, without any underwriting or health questions, regardless of how sick you are. So it's the Pareto rule, the old 80-20 rule. 20% of the folks on the plan G make up 80% of the claims. And who are those people? Those are chronically sick people who exercise their guaranteed issue right when they move in their Advantage plan and the new location's not offered there. Or you might have an Advantage plan that just simply the following year just isn't offered. That's a gift for chronically ill sick people that would much prefer a supplement, and you would go with the plan G. The plan N does not accept these sick people, all right? And again, if you want more information on that, click on the video at the end of this video, and you can look at it. So to recap, plan G, plan N, virtually the same thing. They both have a $240 Part B annual deductible. That's the Part B premium. The Part B deductible, which for 2024 is $240. And also, once you hit that deductible with the plan N, you got a doctor copay between $0 up to $20, emergency room $50. The plan B does not cover excess charges. I've been doing this since early 2010. Never have I seen a situation so far, maybe I will, where excess charges came into play. And you can learn more about that on the next video. All right? Thanks. Okay, guys, the last plan that we're going to talk about is the high deductible plan G. Great plan if you live in one of those states like New York, Massachusetts, Connecticut, one of the states that has community rated or where you basically do not need any underwriting. You could have cancer and you can get a Medicare supplement of your choice any time of year you want with no health questions or underwriting. There's only a few states like that, and I'm going to put those up in a second. But Medicare supplement high deductible plan G it's a $2,800 per year deductible. That can change over time. It was less the year before, and the year before it goes up a little every year. All right, but the benefits remain the same. Once you hit that deductible, you pay nothing for the rest of the year. If you have the high deductible plan G, you pay the Medicare cost for Part A. So your Part A is $1,632. That's your Part A deductible. If you go into the hospital, you're going to pay $1,632. Okay, so you pay the Medicare Part B deductible, which is $240, just like the regular Plan G and the regular old Plan N as well for medical services. And you also have to pay that 20% of everything. It's because Medicare pays 80% of your coinsurance for things like MRIs, outpatient surgery, blood work, doctor's visits. You pay the other 20%. So you got to pay that 20% until you reach that $2,800 magic number. That's your Plan G high deductible for 2024 is $2,800. Once you reach your $2,800 high deductible, at that point, the high deductible G kicks in. It pays 100% of everything. But something you got to keep in mind is that in most states, these plans are medically underwritten. So you've got a 6-month period. You have 6 months from the time you enroll in your Part B or you turn 65 and you get your Part B, or you enroll in Part B a little bit later because you were working. You got 6 months from your Part B effective date to enroll in the Medicare supplement of your choosing. It could be G, it could be N, it could be the high deductible G. But after that 6-month period is over with, you have to pass underwriting. You have to answer questions. You have to answer no to a bunch of health questions. They're going to do a medical check. They're going to look at your medications over the last 2 to 3 years. They're going to look at your meds to make sure that the meds that you take are not on their banned list of drugs. If it's on their banned list of drugs, you can't get a Medicare supplement. You're stuck in the supplement that you enrolled in during your Medicare supplement open enrollment period. Medicare supplement open enrollment period is at 6 months from the time you turn 65 or enroll in Part B. That 6 months is the best time to get a Medicare supplement because there's no health questions, no underwriting. They cannot deny you. So, you know what I'm thinking is if you have a history of maybe something like cancer in your family or some type of lung disease or whatever the case may be, you got to really, you're just not on Medicare for this year. You're on Medicare for life. So if you get the high deductible G plan and in 3 or 4 years you get chronically ill, or maybe you already have a pre-existing condition like rheumatoid arthritis, not good. You're not gonna pass underwriting with rheumatoid arthritis. You're not gonna pass underwriting if you're taking over 50 units of insulin. Pretty much if you take insulin, unlikely you're going to pass underwriting, all right? So you need to consider not just what you're on for this year, but for the rest of your life. Because after that 6-month period is up, let's say you got the high deductible G and you're with AARP and you want to switch in 2 or 3 years, you want to switch to the Plan G within the AARP umbrella, you got to pass underwriting. It doesn't matter that it's still AARP United Healthcare. They're still going to make you answer health questions. Or if you go from one Medicare supplement company to a different company, you're going to have to pass underwriting. They're going to ask health questions. They're going to do a med check. All right, so you just got to consider that when you're picking a supplement for the very first time when you're turning 65. So there are a few states that have guaranteed issue rules like Vermont, Connecticut, Rhode Island. I know there's a few other. I'm going to put the list up for us. Guys, this is really important, probably the most important thing you'll take from this. When you're new to Medicare, or let's say you've been on Medicare for a while, and the worst mistake I see are people that are 65 that go with like Blue Cross or United Healthcare ARP. They get a Plan F or a Plan G, and they're on that sucker for the next 10 years. What's happening each year is they're getting rate increase. And with the Plan F and the G, you get the highest rate increases, especially the Plan G, at least in Beaufort County. So these are standardized policies. If your agent's not calling you every 2 years to try to change you, if you're healthy enough, you're losing thousands and thousands over a period of time. What happens is if you let's say you're with Mutual of Omaha for 3 years, great company. I use Mutual of Omaha all the time, but I certainly don't have someone on Mutual of Omaha from the time they're 65 to 75, because the problem with that is rate increases. You need to change every couple of years. Every couple of years, you need to change supplements to reset that rate. And this is and just remember, this is right here. Medigap policies are standardized or identical. Insurance companies can sell you only a standardized policy identified by letter. We talked about the N, the G, the high deductible. How do I compare Medigap policies? Different insurance companies charge vastly different premiums for the exact same policies. You're shopping a policy, make sure you're comparing a G to a G, the same lettered plan, an N to an N or F to an F. All right, so I'm going to leave on this. I'm going to show you something right here. All right, guys, real quick. So 73-year-old male, Plan G. What are we looking at? Lowest. And now remember I said here, different insurance companies charge different premiums for the exact same policy. Really? Well, let's see. For a 73-year-old male, Plan G, $113.59. We could keep going down if you want. Aetna's 150, Blue Cross 178. But I like my Blue Cross. They pay all my claims. I've never had to pay a bill. Here's the thing, guys. Medigap policies are standardized. They must follow state and federal laws designed to clearly identify themselves as a Medicare supplement. They must offer identical benefits. They all pay your claims. Doesn't matter if it's USAA, AARP, Allstate, they're identical plans. So, I don't like that when I hear that. Well, Chris, they've always paid. They've been good to me. They haven't been good to you. Allstate's 113. Blue Cross is 178. But here's the thing. I know some of you are saying, hey, wait a minute, Chris. I'm a 73-year-old male. I'm not paying $135 for Mutual of Omaha. I'm paying about $180. Actually, $185 if you started when you were 65. Why? Because the rate increases. This is for the $135 for Mutual of Omaha is someone that just is brand new at age 73 that's healthy, that just passed underwriting. They get $135. So if you've been on Mutual of Omaha since you were 65, you got rate increase. You're going to pay more like $180, $185. I just took somebody off that was 73 years old here in Beaufort County. He was paying right around $184, $185. He's been on Mutual of Omaha since he was 65. I put him on the Humana. We got him down to $119. Not bad. From $185 down to $119. So don't yell at me. Chris, I'm paying $185, not $135. It's because you've been on it for a while. Your agent's lazy, hasn't communicated with you. Yeah, stick with what stick. It pays your bills. They all pay your bills. This is the kind of insurance it pays to change every couple of years. Or on your policy anniversary date, you get a letter that says, I got a 12% rate increase. And just for blinks and giggles, if we look at the Plan N, take a look at the Plan N. And this gap between the G and the N rates is going to widen, guys. It has to because of the healthy guaranteed issue people. So what are we looking at? Wow. You can get down Allstate, $86. Humana, $93. Medico, $95. So as each year goes on, N is going to go up 0 to 3%. Most of my clients are experiencing 0 to 3% rate increases. Plan G, they're looking at much larger rate increases. I did the math. For somebody who was on Mutual of Omaha, which I like Mutual of Omaha early on, but you got to change to reset those rates. All right? So Mutual of Omaha's Plan N, very stable. Mutual of Omaha's Plan G, not so much. You got the rate increases because remember, Plan G has got to absorb the high cost of sick folks who are moving to Bluffton, to Beaufort. They have an Advantage plan. They made a mistake. Their agent was financially incentivized to sell a Advantage plan. We make $605 on a new to Medicare for an Advantage plan. We make half that, less than. We make, for an Advantage plan, you're looking at $603. I get 22% of the annual premium for a Medicare supplement. Comes out to about $240 commission. You don't pay that to me. The insurance company pays separate to me. Whether you go direct to the carrier or you use an independent broker, you're going to pay the same premium. It's just like a house or car insurance, all right? So why not have a Medicare advocate that's going to actually take the time every couple of years to see if you're okay, to see if maybe it's time to make that change, to reset those rates, all right? So that's all I got. And if you look below, there's a subscribe button. I would love it, guys, if you could just hit the subscribe button and be a part of May River Medicare Insurance. You can see the videos. You'll be alerted when we have our next video. I've been cranking out 1 to 2 a week. Would love the chance to do an analysis of your current situation. Just remember, we got till March 31st. If you have a Medicare Advantage plan and you're ready to change to a supplement, all we got to do is get you a policy issued. Once we get it issued, we would switch from your Advantage plan to a Medicare standalone Part D drug plan, which will kick out that Advantage plan, and you got real insurance starting on April 1st. All right, you guys have a great day.